The subject of today's lecture is the arm and forearm. Let's start. In previous lectures, we discussed the actions that take place at the scapula and shoulder. In this lecture, I will describe the actions that occur at the elbow, the radial ulnar joint, and the wrist. The muscles responsible for these actions are found in the arm and forearm. Let's begin by describing the muscles responsible for flexion and extension of the elbow and pronation and supination at the radial ulnar joint. For convenience, I include this table that lists the muscles that flex and extend the elbow and supinate and pronate the radial ulnar joint, and the nerve supply for these muscles. If you wish, you can stop the movie and read this table at this time. We start by looking at the muscles that flex the elbow joint and supinate the radial ulnar joint. These muscles are found in the anterior compartment of the arm. The most superficial muscle here is the biceps brachii. Although the biceps can flex the elbow joint, it only does this when it is load-bearing. Try this on yourself now. Flex your elbow and press against your biceps. Did you notice that it remained lax? Now try and pick up something heavy and notice the bulge in your biceps region. This is what is meant when we talk of the biceps as being a flexor of the elbow joint when it is weight-bearing. In contrast, the biceps brachii does function as a major supinator of the radial ulnar joint. This is the action one does when trying to tighten a screw with a screwdriver. We righty-tighty, but lefty-loosey. If you are right-handed, perform the action of turning a screwdriver clockwise. The reason that screws are so designed is that we have major muscles for tightening screws in contrast to muscles, pronators, that are used to loosen a screw with a screwdriver. Now repeat the action of supination with your left hand. Instead of tightening a screw, you're carrying out the action of loosening a screw. What this means is that there's no such thing as a left-handed screwdriver. Deep to the biceps brachii is the brachialis muscle. This muscle is the true flexor of the elbow joint, and this is all it does. There are additional muscles that can help flex the elbow joint. These muscles are found mostly in the forearm, but because they take their origin from the humerus, they can help flex the elbow joint as well. On the lateral side is the brachioradialis. Although this is the true flexor of the elbow joint, it functions best when the forearm is partially pronated. Try this on yourself. This is the reason that tennis players have such a well-developed brachioradialis on the prominent hand. It is used constantly to stroke the forehand. On the medial side, the first muscle we observe is the pronator teres. And as well, taking their common origin from the medial condyle of the humerus, are the superficial flexors. We will discuss these muscles in more detail in a bit, but for now, realize that these superficial flexors can help flex the elbow also. There are deep flexors too in the forearm, and these also help to flex the elbow. We will talk more about their action in a second. But first, let's discuss the muscles that pronate the radial ulnar joint. When we mentioned the biceps brachii muscle, we described it as the major supinator of the radial ulnar joint. There are two muscles that bring about the opposing action of pronation. The first muscle we see is the pronator quadratus, or the square pronator. The second muscle is the pronator teres, or round pronator. Although there are two muscles responsible for pronation, their mass is much less than the one muscle responsible for supination, the biceps brachii. Hence, this is the anatomical basis for why supination is much easier to perform than pronation. Moving along, we previously discussed flexion of the elbow joint, so now we need to address extension of the elbow joint. There's only one muscle in the posterior compartment of the arm, and that is the triceps brachii. It consists of three heads, hence its name. And finally, since we have been discussing supination and pronation of the radial ulnar joint in this section, it makes sense to discuss one last muscle that is involved in supination, the supinator. The supinator is a muscle of the posterior compartment of the forearm, and its sole function is to supinate. Do not make the assumption, however, that supination of the forearm can be performed in the absence of a functioning biceps brachii. The supinator is not a powerful muscle and tends to be quite small in mass, in the order of the pronator quadratus. The supinator muscle, however, has some clinical significance. The radial nerve sends its deep branch deep to the supinator muscle, between it and the radius bone. Repetitive action of supination may inflame this tunnel and lead to the painful condition of radial nerve entrapment. This now concludes the discussion of the elbow and radial ulnar joints. Let's look now and see what happens at the level of the wrist joint. There are four actions that take place at the wrist joint: flexion, extension, abduction, and adduction. As before, I include a table for your convenience describing the muscles, their actions, and the nerve supply of the muscles that act at the wrist. There are only 9 muscles to learn. But it is really not as bad as it may sound at first. The muscles are arranged as layers in the forearm, and they are described as such. However, do not think that you need to memorize which muscles are found at which layer. The presentation of the muscles as being in layers is done simply for descriptive purposes. There is no clinical relevance for learning this distribution. Let's start and describe the muscles that are found in the first layer. From the medial border of the humerus, from a common flexor origin, we observe the flexor carpi radialis. As its name suggests, it flexes the wrist. Next, we encounter the palmaris longus. The distal insertion of this muscle is in the palmar aponeurosis, a tough connective tissue layer of the palm of the hand. Not everyone has a palmaris longus. You can check in yourself by flexing your wrist and looking for a prominent tendon that bulges outwards. Some people are missing this tendon on both forearms, whereas others are missing it only on one side. Given that we previously mentioned a flexor carpi radialis, we must also have a flexor carpi ulnaris. This one is on the ulnar side of the forearm. Moving on to the second layer, we find the flexor digitorum superficialis. This muscle extends to the phalanges and is a principal flexor of the digits. However, given its location, it too assists with flexion of the wrists. We now encounter 2 muscles that we saw previously. First, the pronator teres, and second, the brachioradialis. Although these are found in the first layer of the forearm muscles, they have no action at the level of the wrist. Hence, here's an example of where knowing topographical information, for example, the muscles found in the first layer of the forearm, does not assist you in knowing about the action of these muscles. Next, we move to the third and fourth layers of the muscles of the forearm. We had seen the flexor digitorum superficialis previously. Now we observe the flexor digitorum profundus. It too is a flexor of the fingers, but as well assists with flexion of the wrists. And next, we see the flexor pollicis longus, the flexor of the thumb. Pollicis in Latin means thumb. Finally, we reach the fourth layer of muscles, and here we find the pronator quadratus. Again, this is a muscle of the forearm, but that has no action at the level of the wrist. Its sole function was to help pronate the radial ulnar joint. We now move to the posterior compartment of the forearm and examine the muscles that bring about extension of the wrist joint. On the lateral side, we find two extensors of the wrist that are located on the radial side of the forearm. One is longer than the other. Hence, we assign them the following names: extensor carpi radialis longus and extensor carpi radialis brevis. Since we had extensors of the wrist on the radial side, we need to have extensors of the wrist on the ulnar side, but we only have one, called the extensor carpi ulnaris. We also have one muscle that helps extend the wrist, but its principal function is to extend the digits, the extensor digitorum. And some of the digits have their individual extensors. Their muscle bellies are found within a deeper plane of the muscles of the forearm. Among these is the extensor digiti minimi, the one we use at high T. Three muscles go to the thumb. The first one we see is the abductor pollicis longus that helps abduct the thumb. Next, we see the extensor pollicis brevis, an extensor of the thumb. And the third muscle is the extensor pollicis longus, as its name suggests, another extensor of the thumb. These two last muscles are used when the thumb is extended, the universal sign for hitchhiking throughout the world. The gap between the two extensors at the wrist is known as the anatomical snuff box, although not always used for snuff when hitchhiking back in the 60s. You should be able to feel the pulse of the radial artery in your own anatomical snuff box. The index finger has its own extensor, the extensor indicis. And finally, to be complete, there are two muscles found in this posterior compartment of the forearm but have no action at the level of the wrist. These include the anconeus, that functions at the elbow joint, and the supinator, whose action we discussed previously. For those of you that play tennis and have experienced tennis elbow, it occurs from inflammation of the proximal attachments of the extensor carpi radialis longus and brevis. However, tennis elbow is actually a misnomer. The condition results from innate repetitive action involving supination extension. Thus, it is really an occupational hazard of working individuals. We have looked at quite a few muscles in this section, and perhaps one might think their innervation is quite difficult to learn. In reality, the innervation of the limb is rather straightforward. Think of the limbs as being organized into compartments. Each compartment, and consequently all the muscles within a particular compartment, will be served by its own nerve. For example, the anterior compartment of the arm, where the biceps brachii, the brachialis, and the coracobrachialis are located, are all innervated by the musculocutaneous nerve. The posterior compartment, on the other hand, the location of the triceps brachii, is served by the radial nerve. We now move to the forearm, and the fascia in this region also segregates the muscles into compartments. The muscles of the anterior compartment of the forearm are separated into a superficial group and a deep group. In the posterior compartment of the forearm, there is also a deep group of muscles and a superficial group. And now that we have defined these muscle compartments, we can describe the nerves that serve each of the compartments. All the muscles found in the anterior compartment of the forearm, both the superficial and deep groups, are innervated by the median nerve, except for two muscles, the flexor carpi ulnaris and half of the flexor digitorum profundus. These are served by the ulnar nerve. The posterior compartment is even easier to remember with respect to innervation than the anterior compartment. There's only the radial nerve that innervates all the muscles found in the posterior compartment of the forearm. This now concludes the lecture on the arm and forearm muscles and their innervation.